It's only week 2 of the NFL season, and we're already down 4 starting quarterbacks from what we expected to see. Of course, Andrew Luck retired unexpectedly before the season began, Nick Foles fractured his clavicle in week 1, Drew Brees is going to have surgery on an injury to a ligament in his thumb, and now, of course, we've gotten the news that Ben Roethlisberger is going to miss the season for surgery to his throwing elbow. Welcome back, everybody. For those new, my name is Brian, and I'm a doctor and a sports fan, and this page is your #1 resource to learning everything about sports injuries and sports medicine topics. We're going to talk about UCL injuries in this video, and more so focus on what happened with Ben Roethlisberger. While we have official news he's undergoing surgery for the elbow, we haven't heard officially that it's the UCL ligament, so keep that in mind during this video. We'll talk about UCL elbow injuries, but it is still possible that there's something else that we just haven't found out. Make sure and go subscribe if you like this type of content and want to stay up to date with future videos, and let's get started. If you were like most people, whenever you saw the injury to Drew Brees and heard people throwing around the word UCL injury, you might have thought, wait a minute, I thought the UCL was a ligament in the elbow. You know, Tommy John surgery, the injury that a lot of baseball pitchers suffer from. And you're right, we have UCLs in different places in our body because it's just a descriptor for the anatomical location and function of that ligament. UCL stands for ulnar collateral ligament. Ulnar implies the anatomic location of the ligament in relation to the rest of the body. Collateral, meaning it's on the outside or it's providing side-to-side stability, and then of course ligament because it's connecting different bones. So yes, in the case of Drew Brees, we have an ulnar collateral ligament in the thumb, positioned on the ulnar side of the thumb and providing that collateral support, but we also have an ulnar collateral ligament in the elbow. Let's talk about anatomical descriptions. Pulling up an image here of the bones in our arm, we of course have the humerus up top, and then the radius and the ulna down in the forearm. There's a couple of ways to describe this, but we can talk about the medial side of the arm, or the inside part of the arm, or the lateral portion of the arm, which is the outside. We can also describe things in terms of ulnar or radial side, corresponding to the side of the forearm that we're talking about in relation to that bone. So the ulnar side is on the side of the ulna, and the radial side is on the side of the radius. If we get into the thumb, the same rule applies. And so in the case of Drew Brees, his UCL injury is down here in the ulnar side of the thumb. But when it comes to Roethlisberger, of course, the fear is that it's the ulnar collateral ligament up at the elbow. The ulnar collateral ligament in the elbow originates at a location in the humerus called the medial epicondyle. It then fans down to insert on the ulna in the forearm. Interestingly, the UCL is actually comprised of 3 specific bands or specific components. There's the anterior bundle, the posterior bundle, and then the transverse or the intermediate bundle. The primary function of the UCL in the elbow is to resist valgus stress. The elbow experiences this type of load whenever the arm is extended and it's bent backwards at the elbow. So if we look from the side, when the elbow comes backwards into this rotation, that stress bending backwards at the elbow joint is considered a valgus stress. You can apply a valgus stress to any joint in the body, just depending on which direction you apply the force. Looking at my arm, those UCL ligaments sit here on the inside, and so anything that pushes my elbow in a way that's going to stretch those ligaments is providing a valgus force. This is extremely important with throwing athletes because that throwing motion is a valgus stress on the elbow, and that UCL is there to help provide that stability and keep the bones from just flopping apart. Interestingly though, the UCL in and of itself isn't actually strong enough to maintain the load of just throwing a fastball or throwing a football. So to help make up the difference, we have muscles that also span this region of the UCL ligament that provide what we call dynamic load support to the elbow. These are the muscles that flex your fingers and flex your wrist, and so it's the common flexor mass that lies kind of right over top of the UCL and provides additional support and stability. We of course saw with Roethlisberger that he had a couple of throws this past weekend where he clearly was in a lot of discomfort after the fact. This is because with that excessive load on an injured UCL ligament, it's going to be painful and cause a lot of symptoms. There's also a nerve that runs really close to that area called your ulnar nerve, and it's also considered to be your funny bone nerve. It provides control to different muscles in the forearm and controls the sensation on the outside portion of your hand. As you probably know already, UCL injuries are by far much more common in a baseball pitcher than they are in a quarterback. But both involve throwing motions, and so both involve athletes putting an excessive load on that UCL ligament. The difference though, in a baseball pitcher, there's a lot more torque and a lot more speed that's generated as a result of that throwing motion compared to a quarterback. They also get more external rotation, so when we see these pictures of pitchers with their arms externally rotated way far back, it's a lot more extreme than we see in someone who's throwing a football. One interesting clip I want to show you guys as well, one of the tests we do in the exam room to determine if this ligament is injured is called the milking test. There was a really cool video of this being done to Josh Allen, and what they're trying to do is mimic that valgus stress. So the examiner is pulling on the thumb and trying to tell the athlete to throw, like they're going into a throwing motion. When you're pulling backwards on the thumb, going into that throwing motion stresses the UCL, and so as you can see from Allen's reaction, if there's injury there, it's gonna be really, really painful. So same type of mechanism, but different loads in the two different sports. This is why it's much less common in a football quarterback to have this injury compared to a pitcher. But we have seen football players have this, in particular Jake Delhomme, and then just last year, Josh Allen had to miss some time because of a UCL injury. Now, like I said, we don't have the final word, it's the UCL ligament, and there's a lot of different surgical techniques they can use if it is in fact the UCL ligament that's injured. If we get that information, I'll do a video talking about those surgical techniques and what's different between them. But for now, hopefully this is a good background to the anatomy and sort of the mechanism and function of that ligament. So 2 injuries concerning for the UCL, or the ulnar collateral ligament, but you can have different ulnar collateral ligaments in different locations. Brees is expected to make his return this season, while Roethlisberger is going to be out for the rest of the year. Stay tuned to the channel. At the end of the week, we'll do an update video if we've heard any additional information from the time I released this one. But until next time, everybody, thank you for watching, and I'll see you later.